Welcome again. I'll give you a brief on the situation of Mpox in Sierra Leone and what are the main gains that actually we have been able to achieve over the past couple of weeks. The new confirmed cases, that is from the 23rd to the 28th, 1 week, is 333. The recoveries for this week is 38. Number of deaths, 1. Cumulative deaths is 15. And then the total number of positive cases that we have registered since the outbreak is 3,185. And 1,738 have recovered. The contact line listed for follow-up, 1,512, and the total number of persons that have been vaccinated so far is 42,872. What are key achievements over the past couple of weeks? The first one is the establishment of the 400-bed treatment center at the police training school. We continue to transfer cases from the communities and from isolation centers to this facility at Hastings. The background to that is one of the ways we think we can cut the chain of transmission is to make sure that we remove all positive cases from within the community to treatment facilities. And the 400-bed facility is one of the facilities in our effort to establish minimum of 1,000 beds countrywide. And then we have deployed teams to all the districts in the country to support the DHMTs in their surveillance and case identification. Contact tracing and rapid diagnostics continues, and we have also deployed rapid response teams to all the districts. We continue to supply IPC commodities to all our Mpox treatment centers, and as I speak, we are doing testing in 8 laboratories countrywide. So we have expanded our testing capacity. For risk communication and community engagement, the team is continuing its advocacy in community engagement by using sound and video trucks to reach out thousands of Sierra Leoneans. Community dialogue continues in all the districts, and we have employed 130 youths from the communities so that they can go from house to house in engaging the people. It's a western area and western urban. We want to do same in all the districts. We had a report of a fake job, this was social listening and rumor management. We had a report of a fake job recruitment and fraudulent vaccine administration that was brought to our attention. The fake job was that there was job opportunity to work in the center at Calabar Town under the MSF, but that is fake, and I think they were asking them to pay some money. So that was fake. And then we also received reports of people administering something they call vaccine, which really does not come from the EPI or from the National Public Health Agency. The risk communication continues to address misinformation and is liaising to reduce rumors about what is Mpox, what to do, because there are a lot of rumors. So that is why we continue to have this engagement with the media. For IPC, the IPC refresher training has provided knowledge to our social workers and our healthcare workers, and this is being rolled out in all the districts in the country. And triage stations have been set up at regional levels and designated Mpox centers. Homes of confirmed cases and patient transport vehicles will continue to decontaminate to ensure that we adhere to IPC measures. For coordination and strategic partnership, National Incident Management System mentors have been deployed countrywide. This is to ensure that we harmonize what happens at national level with what is happening at the district levels. And we continue with partner private sector engagement continues in order to close the resource gap, including vaccine acquisition and other logistics. Multi-sectoral coordination meetings with local authorities, civic societies, and disabled persons continues. This is to ensure that we promote inclusivity. For points of entry, that is at the airport and other points of entry, we continue with temperature checks and check for other symptoms. That is ongoing. And alerts from border communities are monitored for cross-border spillover risk. For next steps, we are scaling up the deployment of epidemiologists and surveillance officers in high burden districts. We will be receiving 20,000 doses of the vaccine this Sunday, and it is going to be meant for high risk contacts. We will sustain community-led action initiatives in Bo, Kenema, Kono, Potloko, Bombali, and Western area. These are the high burden districts, so we want to make sure that we engage the community. Stakeholders, influential stakeholders have been asked, they have agreed, and they have already deployed in these districts to make sure that they engage the leaderships in these districts. We want to use the structures that exist at local level to make sure that the message goes to the last person in the country. We'll continue our drive to procure more vaccines through partner coordination. The government is doing everything possible to make sure that we get more vaccines, because it is not a one-prone approach, it's a multi-prone approach, removing sick persons within the community, bringing them other facilities, adhering to IPC measures, vaccinating high-risk contacts. So all these cumulatively work towards breaking the chain of transmission. And there is sequencing in-house. Initially, when we started this response, we are sending our samples to Senegal to do sequencing. Now we have the capacity to do sequencing in country. We have two labs, the Central Reference Laboratory here in Dakar, and then the Kenema Government Hospital lab in Kenema. These are the two labs that are doing sequencing, and as of now, all the result shows that we are still dealing with a 2B clade. 2B clade is what is circulating, and I must hasten to state that what the sequence result has shown us again is that there is intensive human-to-human transmission. There is human-to-human transmission. This has been going on for quite some time. So, thank you very much.